My name is Justin Schroll. I chose to do my current issues in professional nursing as how to cut healthcare costs. This is for Fort Hays State University in fall of 2018, and this is for the class Nursing 449. The current issue with healthcare that I chose to do my presentation on is the inability of people in the United States to get affordable quality healthcare. Many people are below poverty level in the United States at around 12.3%, according to ucdavis.edu, and 15.5% of Americans are uninsured, according to Forbes.com of this year. Currently, we as healthcare providers must figure out a way to provide affordable, consistent healthcare that isn't at the whims and opinions of our elected officials. I will also explore in this presentation other options that under Medicare for All could help to increase access to quality healthcare and also to help keep costs lower. I will also try to give some downsides and drawbacks to each of my arguments. Some of the more widely explored ideas that aren't necessarily free education for medical schools and lowering the amount of debt physicians must take on to practice include Medicare for All and getting younger, healthier patients involved. According to thinkprogress.org, a single-payer healthcare system could cost the U.S. about $32.6 trillion over the next 10 years. However, the U.S. would ultimately save about $2 trillion during this time due to the ability of a single health insurance entity that is government ran to be able to negotiate down the price of prescription medications. Also, Medicare for All initially shows an increase in healthcare spending as many people who have never had access to healthcare receive treatments, including screening procedures. However, these screening procedures decrease our risk over time. An example would be like colonoscopy screening for colon cancer. It obviously is much cheaper to pay for a screening test than it is to treat cancer. Also, by having this screening test performed, we as healthcare professionals can cut down on the need to use the emergency room over the long term. In opposition to this idea is if Medicare is unable to negotiate down the costs of prescription drug prices over the next 10 years, the plan could end up costing $3.3 trillion more, according to PolitiFact.com. Some other downsides of moving into a Medicare for All system would be a large workload that would be placed on the central government and the central entity of the government that runs Medicare. Some growing pains as hospitals and other healthcare entities adapt to the new system as well could be felt. Also, decreased profits for physicians and decreased profits for pharmaceutical companies could also cause a stunt in new medicine research, procedures, and creativity, as there is no further capitalist incentive to create, no further incentive to be creative, according to formapost.com. There would also be a larger wait time for patients in this system, as it takes time for elective, non-emergent procedures to be taken care of. And as for the single payer cost increase, according to Forbes.com, a person could see their state payroll tax increase by 12.5% and a sliding scale individual tax of up to 9.5% of their income tax. Another way to cut costs, according to medicaleconomics.com, is to streamline current way providers bill the insurance companies. Currently, for instance, a doctor might, take a $100 item and bill $2,000 to the insurance company. This, sets off the debate between the insurance company about reimbursement to the physician, and usually the final bill is generally settled about $125, in which the insurance company pays part of it and the patient is stuck with the copay. Generally speaking, by eliminating the time, paperwork, and man hours wasted, there is a potential net savings of around 20% to be had there. Another way to look at cutting costs differently is to mandate that all health information provided to patients be dumbed down, to about a sixth grade reading level, similar to how Medicaid information is given out currently. Um, the way this helps reduce cost is to ensure patients who now don't understand the written materials are getting materials that they can easily understand in a layman's terms. And then this also decreases higher risk of emergency care seeking patients later on that could have been prevented with a phone call intervention prior to admission, which ends up costing more money, according to governing.com. And then continuing on along the same lines of the phone call, we as a profession need to adopt the growing trend of telemedicine. Obviously, the only way to fully treat a patient is to assess them in person, make sure you get your interview down, and then figure out their issues. However, telemedicine does come with its own set of benefits. These include improved access to healthcare providers, even when a patient is in a rural area where it might be harder to, visit a doctor or drive to go see them. Telehealth is also very cost effective as it provides better management of chronic diseases, reduced travel times, and shorter hospital stays. According to AmericanTelemed.org, there is also improved quality of healthcare services delivered via telemedicine, especially in mental health and reportedly ICU care. The other nice part is that patient demand in rural communities for a service like this, because it does help to reduce stress levels of having to travel, for our patients. And then one of the major downsides, according to Rutgers.edu, of telehealth is until it becomes mainstream, is that the patient records may be difficult to access if the physician is not at the office. This could lead to a misdiagnosis or a potential lapse in care. However, telehealth systems will eventually need to be able to have access to all patient records so that the physician can make an accurate assessment and diagnose appropriately. One other way to cut costs would be to have a Medicaid, Medicare preferred drug list, as new prescription drugs that do not have generics out yet generally costs quite a lot more than necessary, since the product development must be paid for within the first 10 years of release. Currently, over the Affordable Care Act, it still prohibits this limitation for drug coverage, which, depending which side of the political aisle someone falls on, this could be considered either a large pro or con, depending on medical necessity of the drug. One other solution to this whole situation would be to give the physician more power to be able to deem that certain medications are medically necessary and to bypass the system entirely without review necessarily. In conclusion, there is no way to stay in this system currently. In some families, the per person average cost of healthcare can cost around $10,000 a person, which is nearly half the yearly income of the median family income of $61,000 according to census.gov in 2018. Currently, across the board in the United States, there needs to be a thorough review of government spending and allocation of funds, as many of our current policies have been created with the idea that our population will always grow rather than stagnate as it appears to be doing currently. We, as informed members of the medical community, need to approach the future with open minds and proper research. Only with peer-reviewed evidence will we find a good permanent fix to the rising costs of healthcare in this country. I thank you guys for your time, and here's my Works Cited page.